Right now, as you're watching this video, your kidneys are filtering your blood every single minute, working quietly in the background, doing some of the most important work in your body. And most people have no idea how their kidneys are actually doing. March is National Kidney Month, and I want to change that starting with you today. Hi, I'm Dr. Eno Nsima Obat. I'm a board certified internal medicine physician with nearly 3 decades of clinical experience here in the United States, and I'm also a 3-time cancer survivor. My personal journey through the healthcare system is what inspired me to create my own independent health advocacy practice because I know firsthand how confusing and overwhelming it can be to navigate your own care. In this video, we're covering everything: what your kidneys actually do, the 5 stages of kidney disease, the warning signs most people miss, and my clear navigation path, a framework I created to help women like you take care of your health with confidence. Stay with me. This one could protect your kidneys and your heart for years to come. So let's start with the basics. You have 2 kidneys. They sit in your lower back, just below your ribs. Each one is roughly the size of your fist. Small, but absolutely remarkable. Your kidneys clean your blood by removing waste and extra fluid, which then becomes urine. They balance your sodium and potassium levels. They help control your blood pressure. They support bone health by regulating calcium and vitamin D, and they help your body produce red blood cells. The kidneys filter your blood through tiny units called nephrons, and the key number we use to measure how well those nephrons are working is called the GFR, the glomerular filtration rate. Your GFR tells us how much blood your kidneys are filtering per minute. A higher number is better. And when that number starts to drop and stays low for 3 months or more, that is chronic kidney disease. Now, let's talk about what happens as this progresses. Chronic kidney disease is divided into 5 stages based on your GFR number. I want to walk you through each one because understanding your stage is the foundation of everything else we're going to talk about. Stage 1, your GFR is 90 or above. On paper, that looks normal, but there is already kidney damage present, often showing up as protein in the urine. Most people feel nothing. This is exactly why testing matters. Stage 2, your GFR is between 60 and 89, a mild decrease in function. Again, no symptoms, but the damage is there and it is progressing. Stage 3 is where I really want you to pay attention. Stage 3A is a GFR of 45 to 59. Stage 3B, 30 to 45. At this point, your blood pressure may be harder to control. You may notice fatigue. Your bones and your blood can start to be affected. Stage 4, a GFR of 15 to 29, is severe. This is where we begin talking about preparing for kidney replacement therapy. This is also when a referral to a nephrologist who is a kidney specialist becomes essential. At stage 5, this is kidney failure. The GFR is below 15, and dialysis or a transplant are typically required to sustain life. Here's what I want you to sit with. Most people don't know they have kidney disease until stage 4, not because they weren't paying attention, but because this disease is silent and often silent for years. So, what can you do to determine if you indeed have early kidney disease? There is a urine test that can be performed to detect a protein called albumin. Even if your GFR looks okay, an elevated urine albumin is an early red flag that your kidneys are under stress. Always ask your health provider for both numbers, your GFR and your urine albumin. If you found this information helpful so far, please hit the subscribe button and share this with a woman in your life who needs to hear this. Okay? The 2 biggest drivers of kidney disease are diabetes and high blood pressure. With diabetes, High blood sugar gradually damages the tiny blood vessels inside your kidneys, and over time, these vessels lose their ability to filter waste properly. With high blood pressure, constant force on those same vessels causes cumulative damage, and if you have both conditions, your risk of kidney disease is significantly elevated. Now, symptoms in the early stages, again, often nothing. But as kidney disease advances, you may notice swelling in your feet, ankles, or around your eyes, persistent fatigue that doesn't go away with rest, foamy or bubbly urine. And that foam is a protein that is leaking out. And also changes in the way and the frequency that you urinate, shortness of breath, muscle cramps, or itching. If you are experiencing any of these symptoms, please contact your doctor immediately. So you may be wondering, what can you do to protect your kidneys? Well, here's the good news. There is so much that you can do. Keep your blood pressure consistently controlled. Manage your blood sugars carefully. Take medications as prescribed. Cut back on salt. Remain physically active. Avoid smoking. And be careful with over-the-counter pain relievers such as ibuprofen or naproxen. These can be hard on the kidneys when used regularly. Most importantly, ask for your GFR and your urine albumin at every routine appointment. Do not wait for your doctor to bring it up. It can be done once a year, but you should ask about it. And speaking about bringing it up, that is exactly what the Clear Navigation Path is designed to help you do. The Clear Navigation Path is a framework that I created to help women navigate complex health situations with clarity and confidence. Let me walk you through how the first 3 steps applies directly to your kidney health. C, clarify. Get clear on your numbers. Ask, what is my GFR? What is my urine albumin? What stage am I in if I do have kidney disease? What does this mean for my daily life? What adjustments do I need to make? L, lead. Take the wheel. Come to your appointments prepared. Ask for the test. Schedule your follow-up lab. Don't wait to be told. Lead your own care. E, empower. Build your knowledge. Understand how your medications, your diet, and your lifestyle choices affect your kidneys at every specific stage. Knowledge is protection. You can schedule an appointment with me. We get to talk about your health situation, your concerns, and I'll help you figure out your next best step. Come find me at drno.com. I would love to hear from you. Listen, your kidneys are working hard for you every single day. Make sure you're working just as hard for them. I'm Dr. No. Until I see you in the next video, goodbye.